Hey everyone, and welcome. Have you ever been on a shift and just thought, there's got to be a better way to do this? Well, today, we're going to dive into exactly that. How those everyday observations you make can be the spark for some really powerful, practice-changing research. Let's get into it.
So, yeah, how do you make that leap? How does that gut feeling you get during rounds, that little voice in your head, transform into a formal investigation that can actually improve care for everyone? Well, that's the journey we're going to map out today.
And this right here is the absolute key. Nursing research isn't born in some far-off lab somewhere. No, it starts right there with you, in the middle of a busy shift. It all begins when you notice a gap, a problem, or a question that our current playbook just doesn't have an answer for. Okay, to really see how this all works in the real world, let's walk through an example. We're going to head to a busy geriatric ward, where one nurse's keen observation is about to kick off this entire process. So our story starts with a nurse. She's on the geriatric ward, and she sees something that's really starting to bug her. It feels like way too many of her elderly patients are having accidental falls. It's more than just a string of bad luck. She knows something's up. It's a real problem. And this is where the research process really gets going, by clearly seeing the gap between what is and what should be. On the left, you've got the current reality, a high rate of falls, which leads to injuries, anxiety, and longer hospital stays. And on the right, you have the ideal, what we're all striving for, a safe environment, better patient outcomes, and a solid, structured prevention program. That gap, that big space between those two columns, that's exactly where our research question is born.
Now, just having a vague worry about falls isn't really enough to build a whole study on. We've got to get specific. We need to break this big problem down into clear, researchable parts. Think of them like Lego blocks for our investigation.
First block, the population. See, for a study to be focused, we can't look at everybody. We have to clearly define the specific group of people we're interested in. This answers that all-important question, who exactly are we studying here?
So for our nurses problem, the population is crystal clear. It's the elderly patients who are admitted specifically to the medical wards. Not pediatric, not surgical. That focus is absolutely crucial. Okay, next up is the independent variable. This is the what of our study. The easiest way to think about it is as the cause that we're going to introduce to see if it creates an effect. It's the new thing, the new strategy that we want to test out.
In our case, that what is a new, structured fall prevention protocol. So we're not just talking about general supervision anymore. We're talking about a specific program that includes things like risk assessments, proper bed rail use, and patient education.
And finally, our third block, the dependent variable. So if the independent variable is the cause, this is the effect that we're going to measure. It's the outcome we hope is going to change because of our new protocol.
And the result we're measuring? It's simple and it's direct. The number of falls. The core question becomes, will our new protocol actually cause the number of falls to go down? That's what we need to find out. All right, so we've got our building blocks, our population, our intervention, and our outcome. Now it's time to put them all together and build our research blueprint, the formal problem statement. There's a pretty simple and logical formula for this. First, you state the type of study you're doing. Then you plug in your intervention, that's your independent variable. After that, you state the outcome you're measuring, the dependent variable. And finally, you get super specific about the population and the setting. It's a formula that's designed for total clarity.
And voila! Here is the final product. Just listen to how professional this sounds. Now look closely at how all of our pieces came together perfectly in one clear, concise, and really powerful sentence. This isn't just a vague question anymore. This is a testable, professional research problem statement.
So we have our statement. It sounds good, but what makes it actually good from a research perspective? Well, let's run it through a quality checklist to see why it really holds up.
A really great research problem has to tick these 4 boxes. Is it significant? Oh yeah, patient safety is as critical as it gets. Is it researchable? For sure, we can define a protocol and we can definitely count falls. Is it feasible to do in a hospital? Yep, seems practical. And is it solvable? Can it give us a clear answer? Absolutely. Our statement passes with flying colors.
Okay, now just to prove that this formula isn't some kind of one-trick pony, let's apply the exact same thinking to a totally different clinical scenario. This really shows you how versatile this whole approach is.
So, picture this. Now, you're a nurse on a pediatric ward. Your new problem is that kids are absolutely terrified during IV insertions. That gap between what is, which is a lot of distress and pain, and what should be, a much less traumatic experience, is massive. And here we go. We're using the same structure for a totally different problem. The study type, a randomized controlled trial. The intervention, distraction techniques, like watching cartoons. The outcome we're measuring, pain perception. And the population, children between 4 and 6. See? It's the same powerful formula, just with different parts.
So why does all this structure matter so much? Because it leads to this, real, clear evidence. This is from a study on this very problem. The group that got the intervention, the distraction technique, reported way lower pain scores than the group that didn't. This is the end goal, right? To get clear evidence that can actually change our practice, and in this case, make a painful procedure a little less scary for a child.
So what's the big takeaway here? It's that this process we just walked through is a universal tool. It's a bridge that can take any concern, any observation, any what-if from your daily practice and turn it into a real question that research can actually answer.
And that leaves us with one final thought to chew on. Think about your own experience, your own unit, your own practice. What's the gap between what is and what should be that you've noticed? What problem is just sitting there, waiting for you to give it a voice and turn it into the next great research statement?